Our next speaker, who is going to come and carry over the conversation, this is none other than Shaukat Ali. He is the CIO at Aga Khan University Hospital. One thing that you need to understand about Shaukat is that he is responsible for all the ICT systems and services across Aga Khan University, global portfolio and hospitals, medical centers and university locations in Asia, Africa, and the United Kingdom. So he's got vast experience when it comes to production and infrastructure, when it comes to IT, all the way from Denmark. And also he's been a global senior IT infrastructure architect for the network infrastructure, and now serves more than 42,000 employees in over 80 countries worldwide. We are glad to have Shaukat here with us, and over to you as you take us through this particular discussion. Welcome and thank you.
Thank you, Ian, for inviting me here, and thank you, CIO Africa, for this opportunity to speak today. Let me share my screen and then we can take from there. So today's topic is COVID-19 influence on business models. And my name is, as Ian mentioned, Shaukat Ali Khan. Let me just talk a little bit about the organization I belong to. So I work for the Aga Khan University, which is part of the Aga Khan Development Network. We're operating in around 35 countries with over 100,000 employees. And out of that, around over 30,000 employees are in Africa, actually. And these are some of our major projects where we work on museums, academies, universities, in 2 big universities in 9 countries. And then a lot of our investments are in Africa. Al Khan University in Nairobi, in Dar, in Kampala, and then many other places. And Al Khan Development Network is there to improve the quality of life of all the people wherever we are operating. And Al Khan University, I will just give you a little bit of introduction. Al Khan University is part of Al Khan Development Network. We are operating in 6 countries. That includes Pakistan, Kenya, Tanzania, Uganda, and Afghanistan, and also United Kingdom. We are operating 7 big hospitals, including the big hospital in Nairobi, and then also 350 healthcare centers. That means we are present in 350 locations around the world in these 6 countries. In addition to all the hospitals, we are also offering bachelor's, master's, and PhD degree programs in 5 countries. In addition, we have a private examination board, and then we are operating a big private hospital in Afghanistan. As we all recall that within the 2 years, actually, the entire business model has been changed, driven by the COVID and all the challenges from the COVID. So what happened? What is the impact? It was, as we all know, that the rising of COVID cases, lockdown and travel restrictions, that means reduced productivity, disruption in in-person meetings, and then all the uncertainty that we have been facing towards. What that translates into our, from our point of view as a university, we have hospitals, so that means patients. We have university, that means students. So patient reluctant to visit hospitals, this was our biggest challenge. Delay in routine diagnostic tests, physical classes suspended. And then from the employee and regulatory point of view, restriction on in-person meetings, high infection rate in hospital staff, compliance to new regulations, and then data requirements by health authorities and lack of awareness in staff. So we were facing all these challenges, and the only way forward was by using technology to mitigate some of these challenges, and that's how we decided at AKU to go on with. So, for example, we initiated a lot of activities to mitigate government restrictions on in-person meetings. We enabled the work from home part. We enabled more than 7,000 colleagues through VPN connectivity, so that they can work from home through Zoom and the Microsoft Teams. Uh, with regards to increased infections in hospital staff, we established COVID-19 management for employee portal. That means that we actually developed a health status reporting mechanism where we were doing the absence and quarantine management through a application called Sihat Check. And then for the data requirements by health authorities, we did a real-time reporting of COVID-19 infections, mortalities, and then recoveries to regulators on a real-time basis. And then interaction and appreciation of frontline workers. We were arranging virtual leadership rounds, workstation on wheel via video conferencing facilities through Zoom and Microsoft. So we enabled continuity of work online through technological tools, data-driven decision-making through provision of real-time reporting. And then from the point of view, from the employees and regulators point of view, we were actually during the mid of all the pandemic, we were doing the JCIA audit also, which is one of the most important accreditation in the health services, and we enabled JCIA accreditation via virtual survey, uninterrupted connectivity, and high resolution video conferencing to facilitate virtual tours, online surveyors sessions, live tracers, document evaluations. Everything was actually done through an online means. And then we run a lot of COVID-19 awareness programs that includes facilitated over 30 webinars and with over 10,000 health specialists nationwide, and where we provided video conferencing functionality for a series of COVID-19 awareness sessions to doctors, nurses, and paramedical staff. And then for the national crisis on availability of expert opinion, because we are operating tertiary hospitals, so there is a lot of expectations from AKU. So we enabled the tele ICU, which means that enable 24/7 tele ICU service with hotline number and then video conferencing facilities, enabling government hospitals to seek expert advice and then monitor ICU patients. So these were some of mitigations we actually experienced, and then we are still using through technology to mitigate all those challenges and then restrictions from the point of view. With regards to engagement with patients and students, because elective patient reluctant to visit the hospital, this was the big challenge. So we developed a family Hifazat app, which is running in one of our biggest hospital at the moment, which actually gives online clinic appointments, payment facilities, provider and patient portal, online requests and medication delivery. So without coming to the hospitals, our patients were able to interact with the physicians so that they can get their day-to-day checkups and then their advices. With regards to deferment in routine diagnostic tests, then we enabled the online access to retrieve phlebotomy requests, medical records, diagnostic test results, everything we put them on online to continue the services from the hospitals. And then we have seen a lot of hesitation in visiting hospitals physically. For that, we enabled the tele consultations, enable the connection between doctors and patients through teleconsults and mobile video conferencing, and we were using WhatsApp and Zoom most of the time. And with regards to all our students, because they were not able to do the face-to-face or physical education, so we introduced and actually expanded significantly distance learning programs by enabling online classes, and then the launch of MS Teams for communication and then collaboration point of view. And then you can see we introduced a lot of applications so that patients can interact with their physicians, students can interact with the faculty, and then we had a for our internal use, we introduced a employee COVID-19 dashboard, where we were monitoring about the status of all the employees, about how they are doing, if they are fit for work, and if they are unfit for work, then what needs to be done, so everything was communicated online to ensure that we can control the spread of COVID within the organization. And then we had a mechanism where we introduced another applications to actually monitor the outbreak. We call it disease outbreak dashboard, where on a real-time basis we were getting the information about what type of virus our patients or the patients we are monitoring they have, and then reporting on a continuous basis, on a real-time basis. So we implemented a lot of all these type of different applications to make sure that we are continuing our operations, we are continuing our business. That means that we are giving services to our patients. At the same time, we are giving education to our students all over. And all this was done through a very dedicated team. So I just want to run a small video to give you an overall perspective of what type of team we are operating, and then what type of skill sets we have, and who are actually behind all this technological speed or technological roadmap we have, and then the way we have executed to mitigate all the challenges in this pandemic time. So let me just introduce a little bit about my team, and then how we are operating.
At the Information Technology Division of Aga Khan University, we are focusing on three important factors. First is our people, and then their ongoing capacity building. The second part is continuous improvement of our processes based on the international best practices. And third one is implementing new technologies or emerging technologies, where we introduce new tools and systems across our campuses and hospitals around the world.
We support all the infrastructure, operations, hardware, network, storage systems, servers, and the facilities that we have within Aga Khan University and hospital.
The Global Solution and Innovation team is responsible for implementing and maintaining all software solutions across all AKU entities.
I'm responsible for ICT in the region, covering the three countries, Kenya, Uganda, Tanzania. My staff consists of about 27 staff spread across the three countries.
It gives me great, immense pleasure that I am part of this EHR implementation with my 7 members. And out of the 7 members, we are 3 women, and we feel powerful being part of this institution for the past 15 years.
I have a 22-member team who are responsible to support and implement basically our in-house developed software in these hospitals.
As internal consultants for the organization, we identify improvement opportunities, remediate complex issues, and develop strategies to improve business operations across the organization. We are also developing business processes for our hospitals globally to implement a huge technology transformation project.
We are responsible to ensure that security controls are implemented across AKU ICT landscape.
And you can say at the end of this video that we were actually arranging online public lectures, because it's also very important for us that to do the continuous capacity building of our colleagues within AKU. Within that domain, we invite experts, international experts from all over the world, and the person who was actually speaking in this video was the CIO of Michigan University. And for example, we have invited the father of internet, his name is Win Cerf, is the chief internet evangelist, on 4th of February to deliver another inspiring lecture. So these are our all in all, in addition to all our day-to-day work operation, we also continuously focus on capacity building of our colleagues and learning from what's happening around the world through these international lectures and through these collaborations with the technology companies. With those words, I would like to thank again the CIO Africa, and then I'm happy to answer if you have any questions. Thank you very much and have a very nice day.